how does TRT compare to a standard first test cycle? Well, I mean, TRT is like, replacement. That's what testosterone replacement therapy is, what TRT means. So it's kind of not like a first test cycle.
Yeah.
So, I mean, if you need it, that's where HRT or TRT comes into play. Otherwise, people are messing around with cycles. They're going on and off and putting their body through, up and down process. And at that point, it's probably not the best. I would say work out, eat, sleep, drink water. I mean, really, really test those genetics of what you got already. Because if you're doing all that, you're going to get some great results, right? Unless you need testosterone. And then at that point, that's where that comes into play. And then your body's functioning at optimal levels and you're just rocking and rolling.
Also, too, is TRT. A lot of times people, like I've said before, people say TRT and they think 100 or 200 milligrams. TRT is through a medical provider.
Yeah.
So even if you're doing a TRT dosage on your own, that's not TRT. It has to be monitored. So don't just say, okay, I'm going to do this amount of milligrams because my friend, that's what he's getting prescribed. Everyone's different. So there is no TRT unless you're doing it through a medical provider. Otherwise, you're just taking testosterone.
Absolutely.
And you don't know what you're replacing because you don't know how much to replace. Like John said, the R is for replacement.
Yep.
So if you don't need to replace anything, a TRT dose is putting you over your levels.
Right.
And you don't know where you're at. So everything goes off the blood work. Everything goes off the levels. Not just your own, personal recommendation. Your friend says, my bottle says 100 milligrams a week, so I'm going to do it. No, it doesn't work like that.
Yeah. I just had somebody call in the other day because he did lab work with us. Guy's totally unsuspecting. His lab's jacked up. I mean, everything's jacked up. And then we call him, hey, listen, obviously, things that you're on or something's going on here. And he's like, I had this issue. My buddies told me to take these things and it would be fine. And man, he is just jacked up. So he's like, what can I do to straighten myself out? And obviously we're helping him through that path, but don't just take things your buddies were like, hey, just take this. It's going to help you out. Just make sure you know what you're doing. That's the best thing I could say. If you're going to do testosterone or any other things, I would just check with a provider that knows what they're doing first. Because it's out there now. Now we're out there, and we've been out here for, 13 years going on. And at that point, there's other places too if you don't want to use us. But there's somebody out there that can help you. It's not like before where you really don't have anywhere to go.
Yeah.
Then you had to go to the buddy or whoever's the biggest in the gym or whoever's helping you out, I guess, in that aspect. So, can HRT increase the risk of certain health conditions such as blood clots or strokes?
Good question.
So, TRT, I guess, could, but it doesn't if you're monitored correctly. So, if you're monitored correctly, no, it's not going to ever happen. But if you're not monitored correctly and you're just going to a provider and they're just giving you testosterone and you're just going about your business and they're not even blood checking you maybe only once a year, then at that point, what's going to go on is maybe your red blood cell count goes high, maybe your hemoglobin hematocrit go high, and at that point, you're going to be at a super high risk for all the things you just mentioned and more. So if you don't want to be in the blood clot, stroke, or DVT category with testosterone replacement, then you should have a provider that monitors you correctly and is at least checking your complete blood cell count very often, at least twice a year, at least twice, maybe more. If you're more sensitive to converting or this happening. And you'll know this after the first couple months. When you check your blood, you'll see, hey, listen, are these things going high or are they trending high? Now, you only have two other options when those do trend high. One, you get a therapeutic blood dump, right? You donate blood, at least 500 mLs per dump. You might need multiple over weeks. The other thing, you lower your dose of testosterone. Now, I see people say, I'll just lower my dose of testosterone. Well, you won't feel as good either. So it's a give and take. I think I'd really want to go get the blood dumps, but there's people that say, hey, listen, I don't got time for this. I can't do this. Well, at that point, then you just lower your dose. So totally on you. Good question, though, 100%.